Good afternoon. My name is Harry Hobson, and I'm with Karen Novak. Karen is our administrator of strategic health initiatives, and what that means is she's also our point person on the coronavirus task force. What I'd like to do today, March 11th, 2020 at 3 p.m., is share with all of our residents, staff, family members, and certainly members of the Harbor Club and others what we know about the coronavirus today, and then bring it home closer and what we here at Plymouth Harbor are doing to protect our residents. Our number one priority is the health and welfare of our residents and our staff. First of all, today, the World Health Organization has announced that the coronavirus is a pandemic. Karen, how would you define a pandemic?
Well, a pandemic is where there is worldwide spread of an infectious disease process that people really don't have immunity to yet. It's a brand new virus, so not too many people have been exposed enough to really build up those antibodies against it.
Well, so far, I know that the United States has more than 1,000 cases of the coronavirus that has been diagnosed, and more than 90 countries worldwide have been impacted as well.
Absolutely, and today the Department of Health for Florida at 11 o'clock this morning identified a total of 19 positive cases here in Florida with 2 deaths. Now the deaths were a little bit of the older population, but again, it's 2 deaths. They had negative testing, 301 negative tests, so I think that's pretty good.
Pretty good. And you talk about testing. I know the Vice President and the National Task Force on COVID-19, the coronavirus, they are very intent on making more and more testing kits available around the country. It certainly is my opinion, and I think that of others, the more testing that is done, those numbers are likely going to go up.
Oh, without a doubt, but I think the good news is with the increase in testing, the testing sites too are going to increase. Currently we have testing sites that were actually just at Tampa, Jacksonville, and Miami, but now the CDC has actually turned that testing responsibility over to the Department of Health. So each county does indeed have a Department of Health, so that's really going to help things out.
Okay. And it's very, very important that we all get as informed as possible and that we stay as calm as possible as we work through this together. And we will work through this successfully. We know that the virus spreads, and it spreads through either contact with someone who's been infected by the virus, or through coughing, sneezing, where the droplets I know can fall onto someone else, and that's generally within a 6-foot distance. Today, that's the new term we've all been introduced to, and that's social spacing.
Yes, that's that 6-foot perimeter that kind of goes around that body, and most of the droplets, if not all, will fall within that 6-foot radius around you. So staying that distance can really be one of those preventative measures that everybody can do, and everybody should take the responsibility. Should you see somebody coughing or sneezing close to you, back up and just go that distance.
Okay, so on that cue, I'm going to ask Karen to back up a foot, and so will I.
Well, again, we're going to review some of those preventative measures that we have a responsibility to do each and every day. Hand hygiene. I cannot express enough about washing your hands. 2 ways to do that. That's with an alcohol-based product, somewhere between 60% and 95% alcohol content. But remember, please remember to let it air dry. Don't be wiping it on your legs, your hands, your arms. Again, let the air have that alcohol evaporate. Then there's good old-fashioned soap and water. It's been around for centuries, and it still works. You want to wash your hands with enough lather that you really get enough bubbles in there. And when you rinse your hands, go ahead and do it in a downward motion. But if you think about it, when you're rubbing your hands together, think 20 seconds. And I know some of us may not sing so well, but 20 seconds, if you sing happy birthday twice, even if it's just in your mind, you'll get to 20 seconds. Rinse your hands, like I said, in that downward motion, so the soap and the bubbles and the germs go down the drain. And then we're going to grab that paper towel, get it off the rack itself, and we actually are getting those new paper towels that are motion censored. So that will help out tremendously. But dry your hands carefully with that paper towel. Then use that same paper towel to use the cover the faucet and turn the faucet off. And then again, use that same paper towel to open the door so you do not contaminate your hands. We talk about cough etiquette. Cover your cough. In your elbow, yes, it does make your elbow have a little bit of germs there, but you can always elbow bump with the other elbow if you want. But covering your cough either with your elbow or a tissue, and then throw the tissue in the garbage. But try not to leave it on the floor. I think sometimes that's not the greatest thing in the world to find on the floor, especially for our environmental workers. We want to keep them as safe as possible as well. Another important thing, and this is really, really important, is just don't go near sick people. If you know somebody's sick, pick up the phone and call them and let them know that you're thinking of them, but try not to actually visit them in their apartment or have that personal space, social space, invaded. Just give them a call. Let them know that you're thinking of them, and if there's anything that you can do, you can always drop it off at their doorway, and then they can come and pick it up at a later time. But again, preventative measures that we all can do.
Good. Thank you, Karen. Most of our residents know this, but maybe some of our families, friends, and members of the Harbor Club are not aware of this, and that is that we've implemented quite a few initiatives here just in the past week. And let me go through just a few of those with you. Campus screening, really essentially from the time you enter our campus and as you float through some of the various areas, there's screening going on. You might notice that I've got a blue wristband on, and I know Karen has one as well. What this tells everybody who looks at me is that when I entered the campus today, I got screened by our safety officers before I was allowed to go to my workspace. And Karen, share with our audience what type of screening we're doing and that I was able to get this badge, as were you.
The idea here is we want to be as preventative and as proactive as we can to prevent that virus or any other respiratory virus for that matter coming into our building. We're going to ask you a few things, 3 questions. The first of which is, have you been out of the country in the last 14 days? And if they say yes, I'm going to ask them where they've been to, and chances are with the travel updates changing so much, we probably are going to ask them to wait 14 days before they come back. Also, too, we're going to ask them if they've had anybody directly in contact with them that may have gone outside the country, and we're going to note that as well. And again, refer them to maybe come back 14 days. 14 days is that incubation period, the highest N, that we want to make sure nobody has a virus that all of a sudden is going to kind of fulminate into that full-blown virus. We're also going to ask if you have any respiratory symptoms. Are you coughing, sneezing, congested? Are you short of breath? And if they have an answer to yes, then again, we're going to refuse them entry and ask them to come back when they're feeling well. We're also going to ask them if we can take their temperature, and then we'll take the temperature. If it's 100 degrees or lower, they're fine to come in. But if it's 100 degrees or higher, again, we're going to refer them to their physician, but not allow them entry. Again, for the safety and well-being of the staff and our residents.
Very good. I felt pretty good about the screening that was conducted on me just a few hours ago when I entered the campus. Respecting social distances, Karen made a reference to that. Some of the things that we've done here, it appears dramatic. I believe it's very necessary. Is it an overreaction? I don't think it's an overreaction until we know more about this virus and just how widespread it is. For example, we at Plymouth Harbor have canceled all of our large group settings, if you will. That means large resident meetings. That means exercise classes in our wellness center. It includes working with the Board of Election. We are a site for the elections, and that has now been moved off of our campus, not unlike other retirement homes or long-term care facilities in this state which are doing the same thing. And we're working with the Board of Elections to try to make it as easy as possible on our residents to still being able to vote, even though it may not be on this campus. We've stopped our valet service for all of our residents here on campus. We will continue to do valet service for guests, and the primary reason for that is because we have a parking challenge on our campus. It's much better if our valets could place the guest cars, if you will. Karen, you alluded to visitations, and we've really limited the visitations on this campus. And talk a little bit about that and really where we're getting some of that direction.
In addition to the things that you physically see happening around Plymouth Harbor, there are things that are happening behind the scenes. And daily, we actually meet with leading age and hear what's going on with the Department of Health through a conference call. They keep us up on the latest information and really the latest regulations that we need to be aware of. Right now, their focus is on visitation and really trying to curtail what is necessary and what is optional. And we're looking at that, staying on top of that. Right now, the screening process is part of our visitation that we're doing here, looking at. The visitation in that we are preventing any kind of infectious disease that we are really aware of with that screening process from coming in. Stay tuned. It's changing every single day, and there are new thoughts coming from the Department of Health and CMS. But we'll let you know when they happen and why, mostly why.
Hey, we're trying very, very hard to communicate at every opportunity that we have. The reason for that is, when there is a lack of communication, then a vacuum builds up, and then other things fill that vacuum. For example, I'm very aware that we're entering the phase of rumors, and some of those have already started to impact. I can assure all of our residents and anyone else watching this tape, as of today, as of this hour, we have no suspected cases of the coronavirus on this campus. We have no one isolated for that reason at all. But these are the kinds of things that I know will fester, rumors. And when that happens, please reach out, contact Karen. You can contact the concierge front desk, and they'll direct you to Karen's line, and we will be as transparent as we possibly can with you. We are also, in fact, we started that today, and that's forming our administrative response team. And what is that? That's something that we did 8 or 9 years ago, and that is that if indeed we start to see some of our hands-on healthcare workers become ill or missing work, remember that missing work can also be if the school shut down. If the school shut down, we've got some single parents that may not be able to make it here to Plymouth Harbor for a period of time. So we are training members of our administrative team to step up and assist the nurses, and particularly the nurse aides, as much as we can, and put, quite candidly, all of our work on hold.
We're actually doing that this weekend, Harry.
Tell me about what we're doing this weekend, although I intimately am aware of it.
Absolutely. I signed you up today, Harry. I gave you a time slot from Saturday 2 to 3 p.m. And a number of our other administrative personnel are going to step up and do an hour each. I think that's the good thing. Another good focus that we have here at Plymouth Harbor is it does take that whole village to really, address the situation holistically. And we have an incredible team that does just that.
You'll be happy to know that I've actually signed up for some more hours on Saturday. I think my shift starts at 7 a.m. until 9, and we'll be going through training. And what does that mean? That means that I believe I'm going to be located also in the tower.
Correct. We'll all be at the main lobby, and that's really where we really want you to focus in on the weekends, is to come in through that main lobby entrance. We're trying to keep things as tight as we can and as safe as we can, and if we can limit that number of entry points, all the better.
So I've been asked a question, and we'll continue to get this. So what's next? What other services might be reduced for the unforeseen future? One thing I can tell you immediately is here on campus, the special nights that we have in the bistro on Sunday evenings, we have decided to suspend those indefinitely. So our residents will be reading more about that over the next couple of days. But what other things can you think of that may impact here at Plymouth Harbor?
I think some of the activities that we're going to do in the pool, maybe, the visitors or the talks that are coming in for Pilgrim Hall will be limited. I think, too, maybe some of the visitation in Smith Care Center and the ALF and memory care, where we have our immunocompromised residents, the highest risk, will probably be changing in the near future, and we're really going to have to pay attention to that. We really want to reduce the traffic going through Smith Care, so if you have to go from the main tower, the Mayflower, to the Northwest Garden, we ask that you not really make that cut through Smith Care Center, that you either go up and over or go down and under.
Karen, I said at the beginning of this that the health and welfare of our residents and our staff are really our top priority. I'm very sensitive, not just myself, but we're all very sensitive to social isolation. And we are trying to address that as much as we can. For example, we're working right now with our wellness department and the administration over in assisted living and memory care to keep some good activities going. We're going to respect social distancing, but also in those areas it's important still to some degree to bring those residents together. We don't want to create too much of a gap. So we are working on that diligently right now.
And one of the ways we're doing that is screening. We screen all those incoming visitors that do the activities with our residents in those areas.
Good.
That's really important.
Well, I think we'll conclude this update for today. We would encourage you to keep your questions coming to all of us. You have that contact information. You can always contact the concierge desk in the tower. Write down your question, your concern, and they will get it to either Karen or myself. Once again, we want to be as transparent as possible, and I can assure you we really do have an excellent team members here at Plymouth Harbor who are very much focused and dedicated on successfully getting us through this event. And it goes without saying, we really couldn't do it without the patience and support of all the residents, and we appreciate that. So until the next time, thank you very much.